So I have a lot of male patients who I also see in clinic, and this can be for gut health, it could be for stress management, but more often than not, it is for testosterone replacement therapy. And I check levels and speak to them about their stress and their lifestyle and how this could be impacting their testosterone levels. But quite often, men of a certain age, it's normally over 40, but if I'm I have seen men younger who have got very low levels of testosterone and require treatment. I always take a personalized approach, speak to them about things like their fertility and their aims and what they're trying to get out of it. Most of the time, testosterone's got a bit of a bad rep from the whole gym and bodybuilders type thing, but I'm not optimizing that way. I'm looking at getting levels to physiologically normal, not over what's physiologically normal, which is sometimes what bodybuilders do. And most of the time, the guys I see want to be treated because their mood is low, because their energy is low, because they're not functioning as well as they used to be, and they just feel old and grumpy and more tired. And taking testosterone, whether that's topically in a gel or a cream form that you rub into your arm or your leg, or using it in an injection form, which can be a long-acting injection, which you have around about 12 weeks, maybe 9 to 12 weeks, or a shorter acting injection that you use every few weeks and maybe self-administer at home. I've just seen incredible differences for mood, for energy, for staying well and healthy. It can be of benefit to heart health as well. Testosterone's had a bit of a bad rep in the past, so it's not good for heart health, but that's if your heart health was already bad. So when I do see someone to begin with, I check their blood pressure and their diabetes markers and their cholesterol and their liver as well, because we're taking these sort of medications, especially in injection form, we need to make sure that the liver can process it. And on a few occasions, I've referred patients to specialists first to get the all clear on their heart health and their liver and things before we start treatment. But if all these things are healthy, then testosterone can help to keep heart healthy. Also do regular checks on the prostate as well. But again, if there's no active issue with the prostate, you can keep the prostate healthy. So really, testosterone treatment is very important. I do end up seeing a lot of husbands of the women I see who are like, I feel so much better, I want my husband to feel better too. But yes, I mean, when I'm seeing a man, we're optimizing one hormone primarily, which is testosterone. When I'm seeing a woman, we're trying to optimize three most of the time, which is estrogen, progesterone, and testosterone. So sometimes it can be a little bit more straightforward to get things right. I've interviewed several men on my podcast. It's Your Hormones, who've talked about their beneficial experience with testosterone therapy. So that's just to get the word out there. It's not just for bodybuilders. It's a normal process that men experience, having a decline in testosterone. It's not as dramatic as the menopause, but it is a normal thing that can happen. And so if you are a man who's experiencing issues with your mood, your motivation, your energy, maybe just feeling a bit flat and not as productive as you once were, or if there is a man in your life who sounds like that could be him, please signpost into this video so they can learn more about testosterone for men. Bye.